All right, next we're going to offer some more natural solutions to women going through any hormonal issue, and I've got the #1 expert on PMS when we come back. We're back talking to women whose hormones are all out of whack and who want some smart solutions for bringing balance back into their life. Now, joining me now is Holly Anderson, who runs the leading clinic in the United States that specializes in PMS. Now, you guys at your clinic have treated, what, over 20,000 women?
That's right, Dr. Phil.
Okay, so you're sitting next to the guru here. You know, I talked earlier about some of the psychological things that you can do in terms of calming yourself and slowing yourself. What can she do during this cycle and before to get it under control where it is not as dramatic as it is?
Well, first off, she should be treated with natural progesterone. That is the treatment that is going to get rid of the estrogen dominance that is causing the PMS. And the other thing that I noticed about her was that she needs to be eating frequently, every 3 hours, because when you have estrogen dominance, it does suppress your thyroid. You're going to have a suppressed thyroid, and you get transient hypoglycemia, which is low blood sugar. And that's where the adrenaline is coming in, and these women are flying off the handle. They're out of control. They're throwing things. They're saying horrible things. And if they would eat small amounts of protein and complex carbohydrate every 3 to 4 hours, this would help tremendously.
Okay, are you doing any of that?
No, she's probably going without food all day long, right?
Well, I tend to just eat 3 meals a day. And I definitely, she's right. That's absolutely what's happening, because I'll put off eating because I've got other things I need to get done. And I do get more edgy.
Okay, so you're getting low blood sugar. And it's affecting your thyroid, and you need to take a natural progesterone. So what do they get? Where do they find it, and what do they take?
Okay, the treatment that works is rectal or vaginal natural progesterone. Oral progesterone does not work for PMS, and the creams that are in the health food stores do not work because they are not prescription progesterone. So it has to come from a medical doctor who specializes in treating PMS.
Okay, and you say it needs to be vaginal or?
Vaginal suppositories, or we have a rectal suspension, and they use that twice a day, every day, in the 2 weeks before the period and during the period. And it does alleviate 150 different symptoms of PMS, the emotional and the physical. So that means cramps, migraines, headaches, fatigue, weight gain, bloating, irritability, depression. And in some cases, women are so depressed that they get really out of control, and they may even try to kill themselves in very severe cases. Yeah,
so it can get, I mean, it can get dramatic, and you're not at that point, but you're certainly agitated and all. Now, so you're talking about eating every 3 hours.
That's right.
And what is the weight impact of the progesterone that you're talking about? Is there a side effect and downside there?
Natural progesterone, they should lose weight. Normally there's a weight gain in the 2 weeks before the periods because they're craving sugary foods to raise their blood sugar. They have the bloating. Some women can gain from 3 to 10 pounds every month, and some women need different size clothes. They can't wear their regular sizes. They have to go into larger sizes. Some women look like they're pregnant. And this is very upsetting to women. And progesterone takes care of all this because it balances with the estrogen, so there's no more hormonal imbalance. So it stops severe pain. The woman who's having the pain on her ovary, it would be worth treating her with progesterone. We've stopped a lot of ovarian pain with progesterone.
Okay. All right, any other major thing that you would say? And I know you need to see the patients and you've got to go through all this stuff, but are there any other building block, foundational sort of things?
Well, there have been treatments offered by gynecologists, such as the birth control pill, which is a no-no. That is not going to treat PMS. That is going to make PMS worse. And we have seen this with the patients who've come to the clinic. They've been on the pill by their doctors, and they say they were just crazy, they were so out of control, you know, they just couldn't stand it. And that is another method that gives a woman more estrogen dominance. And she doesn't need that. You can keep giving a woman estrogen until she becomes crazy. And then they become so out of control, they might have to be admitted to a psychiatric hospital. We've had that happen.
Okay. All right. So are you listening to all this? I mean, there are remedies, the things that Robin's talking about here, the things we're talking about here. So does that give you any comfort at all that this is manageable, Kevin?
Mm-hmm. Yes.
Yeah?
I mean, I learned more just a half hour here than anything before.
Yeah. Well, and there's more to learn.
The guys love us.
Yeah. I'll bet that's right. We'll be right back.